we've done our necessary assessments of his abdominal assessment. I just sort of placed this tube inside his nose. It wasn't here. Just kind of got it and placed it in there for purposes of this. So we're going to pretend to have gloves on through all this because I just used like an entire box. So we also would want to unpin this and measure the length of this tube for him. This was capped. So I'm going to have my paper here, this in case we need to catch secretions, our pH paper, and my syringe. Like I said, I have gloves on for all this. I'm going to open this and withdraw a small amount and do our pH paper, and his pH is going to be a little bit higher because of his feedings. So I'm now going to pull back all of his aspirate, and we'll do this twice until all of it comes out. And if we couldn't get anything, we would check for occlusions, kinks in the tube. Drawing a blank on that, so we'll continue. So now I'm going to take 30 mils, let's say it's 30 mils, and we're going to flush this. Okay, I'm going to close this, set this here. So with my gloves, all this has gloves. Here is my solution, because our order says 75 milliliters, or 75 milliliters an hour. The volume to be infused we're going to do for 4 hours, so we're going to do 300. If it was for a 24-hour period, we obviously would multiply that by 4. I opened my administration set, and I have labeled my tubing with the time and the date and my initials, and that this is enteral feeding only. And on his bag, I could put a label on here saying his initials, time, date, type of feeding he's getting, my initials. This is the pump feeding, so that's what we're using. So I'm going to fill this up, my non-expired solution of TPN. I'm going to close this, hang it. We removed our end cap that is there. Well, not removing it yet. But since I don't have it on there, I could use an alcohol wipe and clean it. I'm going to put this into the pump. Close the pump. Turn on the pump. We're going to clear settings, and I'm going to prime the pump. Hold this down. While this is going, another way we could do a feeding would be to attach a large syringe to the feeding port and hold it above his stomach and pour the stuff directly into that to bolus feeding. Hold prime. That would help. Got you talking. Another way to do it would be having a different administration set, and we could do it by gravity feed. That's coming out, but it had prior water in there, so I'm just watching this air bubble come. We would have the IV pull 12 inches from the stomach, above the stomach. And we would adjust the rate of feed by roller clamp. We counted 75 drops. Air bubble almost out. Air bubble is out. Okay. Now, I have gloves on still. We're going to attach this. Set that there. And so we can hit done here. We can adjust the feed rate. We are going to do 75 mils as per the order. Hour, enter. Volume to be infused, we have 300. So I can hit enter. I'm going to clean up my mess. Well, all this is happening. I'm actually going to disconnect this and put it in here so it doesn't go somewhere into the mannequin. So we're making sure it's feeding. So once it goes to 1, mil coming through. Should probably hit around run helps. What are you doing, Bob? Good? Okay. So that's shown that 1 mil has come. So I'm going to go ahead and turn this off because now it's been about 4 hours and we came back. And with either this closed system or if we were to use a drainage system, with every system basically, we are going to add 30 we could add 30 mils to this bag, whether it was gravity or this, or we can use the 30 mils and flush. And after that's flushed, we of course again are going to aspirate. See what's in there, note the color consistency, place some of this on a pH paper strip, and then put it back according to policy and procedure how much he could have, and we're going to tell him that he needs to stay upright for at least 1 hour. And then we're also going to document how much came out, how much we put back, pH, the volume consistency, how he tolerated it, and I believe that is all. So clean up my mess here and be done. Thank you.